today's topic is on dental evidences in crime scenes and the procedures of reporting. So now we are going on with the chapter of forensic odontology. So this is a small portion of it, dental evidences in crime scenes and the procedures of reporting. So let's go to the contents. Introduction, personal identification, obtaining dental records, identification in mass disasters, identification from dental DNA, and extraction of dental DNA, sex determination, bite marks, lip prints, documenting and reporting, dentist as an expert witness, case study, and conclusion. Coming to the introduction, forensic odontology is the branch of dentistry which, in the interest of justice, deals with the proper handling and examination of dental evidence and with the proper evaluation and presentation of dental findings. So it's a branch of dentistry. Okay. We are finding out with the handling and examination of the dental evidences and proper evaluation and presentation of the dental findings. And forensic odontology delves into identifying unknown human remains through comparison of post-mortem dental evidence with dental records of the presumed deceased. Assisting at the scene of a mass disaster and the deceased identification. Elicit the ethnicity or population affinity and assisting in building up a picture of lifestyle and diet of skeletal remains at forensic and archaeological sites. Then assessing the sex of skeletonized remains and age estimation on both living and dead. Actually, recently some films are there that a cold case and one more film is forensics or something like that. So in that they are dealing with the forensic odontology. They are taking the tooth remains or something for the legal purpose. And the next is analysis and investigation of bite marks found on human tissue, animal tissue, and inanimate objects or foodstuffs. And presenting evidence in court known as expert witness. So that's a forensic odontology. Then when coming to the personal identification, identification is the establishment of a person's individuality. Proper identification of the dead is required both for legal and humanitarian reasons, and status of each tooth should be carefully noted. A thorough examination of soft tissue injuries, paraoral heart tissue fractures, or presence of foreign bodies. All information must be entered into intercourt postmortem odontograph. Then obtaining the dental records means dental records contain information of treatment undergone, any crown or something like that, implant, crown. Okay. And dental status of a person during his or her lifetime and constitute the ante-mortem dental data. Content of all available records should be transcribed onto the intercourt ante-mortem form. So this is the form. Then comparing post-mortem and ante-mortem dental records. So we are taking the post-mortem records and the ante-mortem dental records and we are comparing it. Then features compared include tooth morphology and associated bony structures, pathology, and restorations. An individual with multiple dental treatment and unusual features has a better likelihood of being identified than someone with no extraordinary dental characteristics. So with some individuals with multiple dental treatment or with some unusual features, so you can identify it easily. And identification in mass disasters. So when there is mass disaster loss, such as plane crash or any accidents or something like that. So in such cases, we can find out Almost 50% of identifications in disasters are from dental evidences. Interpol's disaster victim identification guide suggests that the division of odontology section into three subsections, namely postmortem unit, antemortem unit, and the comparison and identification. Same as that of the other thing also, postmortem unit, antemortem unit, and the comparison and identification unit. In case of plane crashes, floods, then earthquakes and all. And postmortem unit at the disaster site, a sketch should be made of the scene. The location at which a body is recovered is noted, and the preliminary examination of the mouth is made on site to evaluate the oral condition. So, preliminary examination of the mouth. Then the dental examination must be performed at the temporary mortuary setup for postmortem examination. So, examining in the mortuary. Then portable dental radiography apparatus should be available within the temporary mortuary. Teeth and jaw specimens may be removed from a body for convenience of examination. This must be labeled to prevent a mix-up. So these all have to be labeled. Then coming to the antemortem unit, members need to collect as much information as possible in the shortest period of time. We have to collect information from the dental clinics they have visited or any permanent dental doctor. We have to collect the information from them. Begins with locating the dental records of the victims, which requires an extensive network of communication with owners, then relatives of the victim and the victim's dentist. Dentist is requested to provide the written reports, radiographs, and study models. Sometimes we have the models, POP models, and also we can take it as study model. Since transcribing and copying could reduce the quality of antemortem information, it is recommended that original records be obtained. All information gathered must be transferred onto the Interpol antemortem odontograph. Then there comes the comparison and identification unit. It commences once all the information from all victims is available. Comparison may be done manually or by computer rate. Data can be sorted by age, sex, presence, or absence of restriction. Antemortem data is taken individually and compared to the postmortem data that is spread out for example on a table. Then identification from dental DNA. Since teeth can resist extreme conditions, they are an excellent source of DNA. So even in the dead remains or from the graveyard also we will get the tooth remains, right? So it's an excellent source of DNA. DNA can be successfully extracted and from the pulp of the teeth recovered from decomposed and burned bodies as well as victims of air crashes. The polymerase chain reaction allows amplification of even highly degraded DNA. This facilitates comparison with a non-biological antemortem sample of the distant, such as hair from a comb, epithelial cells from a toothbrush, or biopsy specimen. If a dissident antemortem information is unavailable, DNA may be compared to that of parents or siblings for facilitating confirmative identification. So that's in mass disasters, what we are doing is like that. And extraction of dental DNA. So how we are extracting the dental DNA. So there are different methods. And there is also sex determination by DNA analysis. In cytogenic grinding by Sweet and Hildbrand, cooling the teeth to extremely low temperatures using liquid nitrogen. Then you can mechanically grind it to fine powder and you will get the sufficient amount of DNA. Then according to Trivedian pro-workers, opening your root canals, scraping the pulp area with a nose medical needle, subsequently flushing off the tissue debris. So according to different studies, the different types of extraction of dental DNA techniques. Tooth need not be to be completely crushed is the main advantage. Then sex determination by DNA analysis, we can use amylogenin, Then amylogenin, major matrix protein secreted by amyloblast of the enamel. Females have two identical ML genes, but the males have two non-identical genes. That's about the extraction of dental DNA and sex determination by DNA analysis. Then coming to bite marks. Bite marks have been defined by McDonald as a mark caused by the teeth either alone or in combination with other mouthparts. ABFO defines bite marks as a pattern left in an object or tissue by dental structures of an animal or human. During sexual attacks, including sexual homicide, rape, or child sexual abuse, bite marks are clustered around parts of body associated with sexuality. Identifying injury as a bite mark. So what we are going to do in bite mark? What are the gross features, whether it is circular or elliptical mark, upper and lower arch. Then central area, echinosis, sucking action. And Cameron, according to the Cameron and Sims classification, this is based on the type of agent producing the bite mark. So based on the agents, we are classifying the bite marks into human, animal, based on materials, skin or body tissue, foodstuff or other materials. According to the Webster's classification, this is especially in case of theft or robbery at residences or commercial establishments. The type 1, which include the food items, fractures readily with limited depth of tooth penetration, like hard chocolates and all. And in type 2, there is fracture or fragment of food items with considerable penetration of teeth. That is bite mark on apple and other firm fruit. And in type 3, there is complete or near complete penetration of food items like marks, that is on cheese and banana. And according to the McDonald's classification, there is tooth pressure marks also, marks produced on tissue as a result of direct application of pressure by teeth. These are generally produced by the incisor or occlusal surface of teeth. Then tongue pressure marks also, when sufficient amount of tissue is taken in the mouth, the tongue presses it against in rigid areas such as lingual surface of teeth and palatal ruby. So we get the tongue pressure marks also. Then tooth scrape marks. These are marks caused due to scraping of teeth across the bitten material. They are usually caused by anterior teeth and present as scratches or superficial abrasions. So we can use bite marks as evidence collections from the victim. Ideally, bite mark evidence should be collected when it is first presented and observed. If a suspected bite mark is criminal in nature, it must be reported to law enforcement authorities. Primary concern is patient care. Protocol for bite mark evidence collection that follows has been recommended by American Board of Forensic Odontology as well as accredited forensic dentist. So this is a bite mark. And what are the sites of bite marks? Usually females are usually bitten breast, abdomen, thighs, buttocks, pupils, males back, arms, shoulders, chest, penis. In case of self-defense, the victim can bite on the hands. You have seen this all in movies and all, right? And arms of the case demographics. Vital information should be noted: name, age, sex, police case number, date of examination, name of examiners, and visual examination should also be done. Visually examine the bite mark and document the following: orientation and location of the mark, type of injury, color, size and shape, contour, texture and elasticity of the bite site, differences between upper and lower arches and between the individual teeth. Visual examination must be done before autopsy when the victim is dead. And coming to the photography, also photograph provide a permanent record of bite marks. No time should be lost in obtaining pictures since the injury changes in appearance rapidly due to healing. Color and black and white photographs from different angles may be taken. Orientation photographs, close-up photographs, okay. So tooth, DNA analysis of the teeth, then what about the bite marks? Then we can collect saliva swabs also. Saliva deposited on skin may have WBCs and sloughed epithelial cells, which may be also a source for DNA, enabling a direct link to the suspected. Care should be taken to not to wash the bite area before swabbing for saliva. A cotton swab nostril with Dettol be used for swabbing. The swab is air dried at room temperature for about 30 minutes, placed in label paper envelopes and stored under refrigeration. This latter prevents degradation of salivary DNA and bacterial. Clothing must also be swabbed for saliva if the bite has occurred through. Use of high intensity alternative light source to locate stains from body fluids enables saliva traces to be recovered even in the absence of visible bite marks. And bite mark analysis include positive identification, characteristic matches between the bite mark pattern and pattern of suspect's teeth. Possible identification, this implies that although the suspect's teeth could have made the bite mark, there are no characteristic matches to absolute certain. And it excludes identification when features on the bite mark indicate that the suspect's teeth could definitely not have caused them. It represents a negative or exclusion. So that's about the bite marks. So next class we will talk about lip prints. Okay, thank you.